Hello, I'm Kim, and today in our educational series, we are going to be talking about the glorious FAJA. This, what we wake up in as we come out of surgery. We're going to talk about why we wear this and for how long and its purpose.
Okay, now especially today I want to talk about FAJAs during tummy tuck and liposuction surgeries. After tummy tuck and liposuction surgeries, this topic will give information about these areas. We will talk about this. In the beginning, early post-op period, you will wake up with these FAJAs and these post-operative first week FAJAs FAJA has to be big size because you will have dressing inside and there will be leakage over there and there will be drain coverage, drain dressings. Okay, so it has to be large. Usually after first week we can go smaller size, or we can adjust this big one with this adjustable area in front of this. Sometimes it might be a zip, but in this there is some latches.
So a lot of times we start out here on this outside latch for the first few days or week, but after some of the swelling goes down and we lose some of the dressings and stuff, then we start to go tighter.
Yes, we can go day by day. Maybe it will take time for like 1 week. After that, we can go with a tighter one. The purpose of this FAJA is, in the beginning, when we use it with binder, that she will show us, Kim will show us. We use this for some purpose. When we do liposuction or tummy tuck, we elevate our skin from underlying framework, bony framework and muscles. So there will be a dead space under skin. So we need to reattach this skin to underlying framework. For this reason, we use these FAJA and binder. We use binders just for 1 week after surgery, especially tummy tuck patients. Because when we perform tummy tuck, there is a risk to have hematome, bleeding inside and collection of this blood. Its name is hematome, and when we have a dead space under our skin, it might happen. For this reason, especially tummy tuck patients has to wear this binder, and they have to make it tight as much as they can handle. This is an important point of especially abdominoplasty, I mean tummy tuck surgeries.
So we want to wear it tight enough to still be able to breathe and move, but not too tight.
Yes.
Because
yes, there are a lot of things, especially when we perform tummy tuck, we do muscle repair. And when we do muscle repair, our intra-abdominal pressure will get high, and it will make pressure also to our lungs, and this will cause collapsing on our lungs. Its name is atelectasis, and it's common after surgery, even any kind of surgeries under general anesthesia. And when we do tummy tuck and when we do this muscle repair, it will be more. And over this, if we do it too much tighter, our collapse will be more and we cannot breathe properly. Okay, so I mean, handling means this. You have to breathe under this pressure. Okay, this is the limit of this pressure. That's what I mean.
Yes, excellent. So not too tight. You want to be able to breathe. You want the fluids to continue to move.
Yes.
But tight enough so it feels like a nice, secure
Yes.
hug bound together. Excellent. So the binder.
Yes, after surgery, patients need a hug.
Yes.
Yes,
Yes.
but maybe your relatives will afraid to hug you, so binders will work for this. That's it.
Exactly. Excellent. All right. So one of the other questions is with a FAJA, sometimes we hear that there's stages of FAJA. So do we have to, you explained that we have one and maybe we have to get another one because our size changed and we need to get one that fits appropriately. But who or why would we need to get a whole nother one? A
Okay.
certain procedure?
Let me explain a whole process and certain procedures about this. Staging, I don't call it like staging, but early post-operative period, I mean 1 week, first 1 week, we use big one. After that, we will use 5 more weeks with tighter one, maybe smaller one. If we can't adjust it enough in the last zip, last stage, if it's not enough, we will go with smaller one. This is not stage 2, this is stage 1 exactly, because post-operative first week is not a stage, because this is just covering and holding all dressing in place and making some pressure. But after this 1 week, we will go with stage 1. And 5 weeks will be enough, 5 more weeks. Totally 6 weeks will be enough for FAJAs. But especially liposuction and BBL patients, high definition liposuction or total body contouring surgeries. After these surgeries, we might need stage 2, which is tighter. But for tummy tuck patients, we don't need this stage 2. This is my treatment plan. This is just unique for me. I treat my patients like this. But stage 2 is especially, as I said before, for liposuction patients, not any cutting surgeries. That's what I mean. For tummy tuck patients, maybe we can use something that can provide us secure, like yoga.
Like yoga pants?
Yes.
Or Spanx?
Yes.
Or things like that.
Something tighter.
Yeah, something tighter that just gives us support around our midsection. No more full body FAJA stuff. Just something that supports our midsection still if we feel that we need it. And for swelling, because at the end of the day, we feel swollen. So those would be helpful so we don't need this.
Yes, that's the reason. And one of the other reasons for using these FAJAs, after surgery, we cut some of lymphatic vessels, I mean. And when we adjust and approximate our skin again, I'm talking about tummy tuck, these lymphatic vessels has to find their own way. They know, our body knows this, and there will be angiogenesis after surgery, but in this phase we have to help our body. These compression garments or FAJAs help this, and they make pressure and the liquid will find its way. That's the point.
So the compression helps the fluids that are building up flow to where they need to
Yes.
go.
For tummy area, for tummy tuck or abdominal liposuction, our lymphatics go to our groin area, okay, and drainage will be there, okay. So we have pressure up to downward in midline, okay.
Yep.
This way. When you do massage or when you have massage from someone else, you can see that they are doing this massage to the groin area. This is the reason, okay? We have to help these lymphatics to find their way.
Help it to drain and move.
Yes.
Yes. Excellent.
And maybe timing or how long they have to wear this FAJA, we can say. In the beginning, around 21 hours will be enough. They can take it off just 3-4 hours per day, not first 3-4 days, but after this they can take, patients can take this out. But after first 1 week, we can make it like 6 hours, and we have to wear it again. Just an important point: we have to wear this enough tight. I can explain like this. If we do it too tight, think like a pipe, okay? When you do pressure over it, enough pressure, there will be leakage inside this pipe. But when you do it too much, it will get collapsed and there won't be any leakage and there will be rebound swelling. Okay, this is sometimes I hear and these complaints from patients that I am using my FAJA properly, but it gets swollen more than without FAJA. This is the reason. It means you do it too tight. Okay, don't do it too tight, but it has to be tight.
Awesome. Thank you for helping us understand how to better wear these and why we're wearing them, because we don't love them, but we know that it's necessary. So thank you so much.
You're always welcome. It's a pleasure to explain my treatment plan, my recommendations to my patients. Okay, this is my treatment plan, and please follow instructions of your own doctors. This is my way and for my patients, and this is general rules, but please ask your doctor.
Well, thank you so much.
You're welcome.
Bye-bye.
Bye-bye.